Hi, this is Jim Eubanks. I'm with PhysiatryNow, and I'm going to be discussing MSK matters, the current state of musculoskeletal disorders in the United States. I'd also like to thank Mike Farrell, who's also a resident physician, and Brandon Barndt for their contributions. So the burden of musculoskeletal diseases in the United States is an important topic as we consider how best to address these diseases. Musculoskeletal disorders are now the second most common reason patients seek care in primary care clinics. 18% of all visits, in fact, lead to a musculoskeletal diagnosis. These disorders affect more than half of the people in the United States aged 18 and older, and nearly 3 out of 4 of those aged 65 and over. The majority of disabling conditions, in fact, are due to musculoskeletal disorders. They're also expensive. So from 2011, 5.7% of the US GDP went to costs associated with musculoskeletal diagnoses. And in 2012, 216 million workdays were lost. So we're going to check out some data from the Hidden Impact of Musculoskeletal Disorders on Americans, the fourth edition, recently put out by the U.S. Bone and Joint Initiative. So persons with chronic musculoskeletal pain often have other comorbidities, which can include things like depression, anxiety, diabetes, and hypertension. And even the partners of those with musculoskeletal pain have a higher chance of having pain themselves. And with the aging population, these disorders are becoming a greater burden on individuals and communities every year. So the combination of a growing and aging population ensures that these costs will continue to increase unless current trends are reversed. So we can look at this diagram here showing the increase in costs associated with musculoskeletal diseases. It's a 220% increase in indirect costs and a 131% increase in direct costs. Direct costs are the costs within the healthcare system, such as treatments provided in clinics and hospitals, including emergency departments, and the cost of prescription medications. The indirect costs represent estimates of lost wages, since adults of working age in the 18 to 64 age range with musculoskeletal disorders miss work more and may earn less. Both types of costs have jumped significantly, so much so that they constitute a significant portion of the U.S. GDP. Between 1996 and 2014, the cost of musculoskeletal disorders represented increasing shares of GDP from 3.44% in 1996 to 5.76% in 2014, exceeding defense spending for that year. In all of these categories, direct costs, indirect costs, and share of GDP, the economic impact of musculoskeletal disorders is increasing. The musculoskeletal disorders affect everyone. So we can look at ages 18 to 44, where they're the majority of concerns clinically. This is the same for those 45 to 64. And musculoskeletal diseases are second most common in 65 to 74 and second most common in those over 75. And we can see that an important issue here is that there remains few NIH research dollars available to study these disorders, despite their increasing burden. And spine-related disorders are a unique case. So we're going to look at that here. Low back pain affects an estimated 80% of adults, which most people in the medical field will have heard at some point in their training. 2012 to 2015 World Health Organization data established that spine-related disorders have become the #1 cause of disability in the world. They are now the #3 most costly health condition in the U.S. And in a given year, 12 to 14% of American adults will visit a physician due to back. So I mentioned earlier the U.S. Bone and Joint Initiative. This is a multidisciplinary initiative focused on musculoskeletal conditions that's endorsed by 63 national governments and more than 750 patient advocacy and health professional organizations. There are 4 primary values at the USBJI: raising awareness and educating the world on the growing impact of musculoskeletal pathology, empowering patients to participate in the decision-making process of their care and treatment, increasing global funding for prevention activities and research, and promoting cost-effective prevention and treatment of musculoskeletal injuries and disorders. So for further learning, I would suggest that you consider these 3 websites, which have a significant amount of information to better understand these issues that we've discussed today. And some things for you to look forward to at PhysiatryNow include more musculoskeletal education videos, a podcast, some rehab medicine literature reviews, and a new website, PhysiatryNow.org. Be sure to check us out on Twitter as well as Instagram at PhysiatryNow.